Hello there, my name's Jay. I'm part of the respiratory team at the hospital. This short video is going to talk you through some basic usage of the Trilogy Evo device. To keep in line with current PPE recommendations, for the rest of the video I'm going to be wearing a face covering. I'm going to pop it on now. The Trilogy Evo is a non-invasive ventilation device. To turn it on, we press the button at the front here. The sound you heard is notifying us that the alarms are active, and the alarm light bar across the top here is also active because that illuminated. Once the device is switched on, we can go through all the different settings in the screen, but I better just highlight a couple of features on the front, sides and the rear of the device. So at the front of the device we have our main on, off and standby button. To the right hand side, the little line here with the green light is indicating that we are using mains power. The little hole here is a light sensor, and then the screen brightness can change accordingly. This button here is the alarm indicator and the alarm silence button. If we move around to this side of the machine, there's a oxygen inlet for low flow oxygen. There's also some fan grills and also the internal battery compartment. It's unlikely the vast majority of users are going to need to go into this compartment, but if you ever needed to, you'd pull that down there, lift the little black latch and pull the battery smoothly out. When the device is running, it tells you what battery power is left, but you can also check the battery's life by pressing the green button. Replace the battery by clicking it back firmly in place and closing the window. So moving round to the other side of the device, this side we often refer to as the patient side. You see there's several ports on this side. However, the most commonly used port for bi-level therapy with this device will be the main patient outlet port here. So it's unlikely that the majority of users in the trust will use these other ports. Moving to the rear device, we have the pollen filter and the integral oxygen inlet blender, which would be connected to the oxygen at the wall. This pollen filter, simple foam filter, can be pulled out easily and is replaced after each individual patient's use. Let's move back round to the front of the device and its usage. So we've turned this device on. At the top left hand side of the touchscreen, you can see there is a home screen. The cog indicates where you would change settings, and the spanner is additional options. The most commonly two screens most users would ever need to access will be your home screen or your cog to adjust the therapy settings. Also of note, on the main screen we have a unlocked padlock, which solely means that you have access to all the settings in the device. We have two batteries indicating the device has two internal batteries set up ready to go. We have the current time, and this little upward arrow here, if we press that one, that's actually to lock the screen. I won't lock the screen just yet because we're about to do the settings. So the decision has been made for a patient to use this therapy. To set it up ready for patient use, we need to always select new patient. Once we've selected new patient, we need to select the default prescription in the top left of the prescription list. So it's highlighted blue. I'm going to select that one and accept it. We then have this warning acknowledgement come up, and this is warning you as the user to ensure on the outlet of the device you attach a bacterial viral filter to the circuit, and you can acknowledge that you've done that part of the procedure. Now, to adjust the settings, we need to go into the cog here. The first setting we adjust is the alarms. So we need to touch the alarm icon, and there's two key alarms that need to be set on the device. First one being circuit disconnect. Once I select circuit disconnect, I then get a time bar, adjustment bar along the bottom of the screen, and our default currently is a circuit disconnect time of 15 seconds. As I've moved this to 15 seconds, we have it displayed in the circuit disconnect time, and we also have a little black triangle appear in the top right corner of the boxes, indicating a change has been made to that particular setting. The other alarm we need to set before we move any further is respiratory rate alarm. Now, as our default backup breath is 10 per minute, we need to set the low respiratory rate alarm a couple of breaths higher than that backup breath limit. We also think it's good practice to set a upper limit for the respiratory rate, and depending on your patient, breathing rate will dictate where you set this alarm. So for this example, I've gone 12 for our lower limit and 40 for our higher. Now I need to accept these settings by pressing that button there. So the alarms have been set. Now on this screen of the settings cog, we could change any of these settings as required. It's reminding us we're in passive circuit mode, which is the most common circuit we use, and it's also indicating that the mode of therapy is spontaneous timed, and for the majority of users of this device, that'll be the most common mode that it is used in. So to change any of these settings, we simply select on the setting we want to change and move the indicator to where you'd like it to be. You do not have to accept that individual one. You could make further changes to the settings if you wished. And of course you've got the plus and minus arrows here if that's easier to use than the bars. I've just increased that inspiratory time to 2 seconds because I'm popping our backup breath rate down to 10. To accept these settings, I'll hit accept. And now, as long as the circuit is in place, you have selected the appropriate mask for your patient and have all the clinical paperwork ready and done certain patient checks that need to be done before starting this therapy, the device is ready to start therapy. To do this, we hit start ventilation. So, once we start ventilation, there's different views that can be chosen to monitor the patient's response to therapy. This first view has the settings of the device down the right hand side, has a pressure bar and certain values here. I'll just silence that alarm. So we're given an example here of how the alarms sound. There was an initial amber alarm and the device was not pleased about a certain aspect of the therapy or its settings. Therefore, it is given as an additional alarm in red. I just pressed the alarm silence button here, which is silence the alarm for a period of 2 minutes. So then we can look into and investigate why it's alarming. So to do that, all alarms will be displayed at the top of the screen. For example, this alarm shows there was low oxygen inlet pressure, and the second alarm was for O2 regulation. And it's quite simple to explain why these alarms have occurred. It's because I set our therapy to have a FiO2 of 40%, but for our demonstration we did not attach the oxygen to the wall supply, hence the device is going to alarm. So we've identified what the issue is, we'd make the changes. I'm going to reset them alarms, go back to my cog, so you can change the settings whilst the device is active with a patient. For this one I'd have to change the FiO2 back down to room air at 21%, apply the changes, and then go back to our home screen, and you can see the changes have been made here. So we were talking about home screens and different views. We click on here to go through the different views. See, before the time we've been able to go through the different views, we've then had an additional alarm sound, and I'll take you through that alarm in a moment. So pick view 1, we just went through these different parameters. Pick view 2, got the settings here, a different setting on here which we didn't have before. The parameter is leak. This will be the leak at the patient's mask, which many clinicians find useful to monitor to make sure patients are getting effective therapy. The third screen is our bar, and wherever this bar is shown, if the small dot here appears darker, then it's the patient triggering a breath. If there is no darkness in the green dot and the device delivers pressure, it's delivering a backup breath. The next view along number 4, if we were numbering them 1 to 7, is detailed on the battery power remaining if we were running on battery power rather than mains. View number 5 is a waveform view. So the top graph relates to the IPAP and EPAP being delivered in this case, and the bottom waveform applies to the patient's breathing. These waveforms are depicted blue because they are patient triggered breaths, whereas if these were breaths being delivered as backup breaths from the device, the inspiration would be orange, like these two breaths we can see here. After a minute has passed, it will then overwrite these breaths and continue the cycle. View number 6 is very clear in terms of monitoring the respiratory rate and other key parameters, and the settings are here. View 7 has the leak, other key parameters, but doesn't have our current settings. Of course, you use which view is most applicable to your patient and what information you would like to gain at that time. So interestingly, an alarm kept occurring as I was talking you through the demonstration, and this was the low respiratory rate alarm. That's because this isn't attached to a patient at the moment spontaneously breathing. It is recognising that the respiratory rate is dropping below our lower limit of 12 that we set, and that's delivering backup breaths. Hence that's why this keeps alarming. I'll just reset that. So that's the main settings of the device. So if you ever need to change the therapy delivery mode, this can be done whilst the device is not running or running. All you need to simply do is click on mode and change it to the desired mode. The most common alternative mode most users would come across is using the device in CPAP mode. Now we've lost our IPAP and EPAP settings and our backup breath rate, because this is purely delivering continuous positive airway pressure. Again, to change the CPAP level, like the other levels of positive airway pressure, you simply hit the option you'd like to change, move the bar or plus or minus, and then say accept. Start ventilation. Now the device would be working in CPAP mode. Again, like I say, the settings in this screen, in this view, are displayed here, and if you did want to change it back during therapy, we could click on mode and select the alternative mode you need, press apply, and it changes the mode instantly. If your patient was going to take a break from therapy, you would press the power button and hit standby. All them settings would be in place ready to go as soon as the patient restarts the therapy by hitting start ventilation. If for any reason you need to give your patient 100% oxygen, then in the bottom left of the screen here there is a 100% oxygen function. Tap that and we press start, and we have a countdown timer for how long it's delivering 100% oxygen. And I'm sure the device will alarm in a moment because we haven't got the oxygen attached for this demonstration. And here we go. I'll cancel the oxygen. So there's one other function, key function, everyday function, which I haven't mentioned, and that is the ability to lock the screen. So we hit this up arrow at the bottom here, you have a hand with a line going through, just tap that and that will lock the screen. It's indicated down in the control panel there that the screen is locked, and of course if there's any hits of the screen by mistake during that time when it's locked, it will give us the instructions of how we would unlock the screen. To unlock the screen, we have to follow instructions and simply hold yes for 3 seconds. Screen unlocked, lift finger to resume, and then you can go back in to whatever settings you would like to adjust or discontinue therapy. Thank you for watching our short video on the use of the Trilogy Evo in bi-level therapy mode. We're doing study days on this device and basic update sessions, which you can book on through the respiratory nursing service. Thank you.